Hey, it's Dr. Denke at Select Spine and Sports Medicine, your chiropractor and Friendswood. Thanks for tuning in today. We're talking about tension headaches. We see a lot of patients who come in with headaches, and typically they classify their own headaches as a migraine headache because it's really bad headache, but not all really bad headaches are migraine headaches. So tension headaches start at the base of the skull, top of the cervical spine, and typically there's some tenderness in this muscle group right here we call the suboccipital triangle. The suboccipital triangle connects the first two vertebrae to the base of the skull, and it accounts for a lot of rotation in the cervical spine. But whenever someone, maybe like yourself, who is seated at a computer or kind of have bad posture and maybe looks down at the cell phone, tablet all day long, or frequently creates a lot of tension in these muscle groups right here. We recently had a patient actually who was a nurse, and so she's looking down at patients, similar to me looking at patients down throughout the day. It creates a lot of tension there in the neck, and that creates tension headaches. Being that those headaches come from tension or tightness in those muscles. So it's important that you have your headaches properly diagnosed, and that way they can be treated the right way. What we do here in the office for patients with tension headaches is sometimes start the patient on muscle stimulation therapy, which helps increase blood flow and soften up those muscles a bit. We also use heat to warm up those muscles. We'll go through a bout of rehab exercises to make sure we stretch and strengthen the proper muscle groups to balance out those muscle groups in the cervical spine. We'll also have a massage therapist on staff that can work the upper back and neck muscles to allow for those muscles to loosen up and allow the chiropractors, myself and Dr. Furman, to work those muscle groups and joints a little bit easier. In here, with myself and Dr. Furman, we provide more soft tissue work known as active release, usually on these muscles here. We'll apply some pressure and stretch those muscles to elongate and allow for increased flexibility and range of motion to the cervical spine. And then finally, we'll apply the spinal manipulation, which is the adjustments that allow to increase the vertebral range of motion and function, and also helps decrease pain in relation to tension headaches. If tension headaches is something that you suffer with, please like this video and share it with someone else who you may know who also suffers from tension headaches, because good chiropractic care can really help with your tension headaches. We'll see you soon.